Some of the treatments may cause lasting damage to a patient's heart. This is especially true if the patient is at risk for heart disease. Dr. Laura Franey is a cardiologist at Spectrum Health, here to talk about the team that monitors every stage of cancer treatment if patients are at risk for, develop, or have established cardiovascular disease. Dr. Franey, good to have you here.
Thank you so much for having me.
I thought it was interesting to learn that it is the advances that we've made in the diagnosis and the treatment of cancers and even the screenings that have necessitated, yay, we get rid of the cancer, we treat the cancer, but then there are these concerns about cardiovascular problems.
Exactly. I mean, there's been so many wonderful advances in terms of cancer treatment that have really prolonged patient survival, which has been excellent, but some of these treatment options can affect the heart function. There's a lot of different side effects that can happen with chemotherapy agents and even radiation therapy, such as heart failure, rhythm issues, chest pain. Some of the agents can even affect blood pressure. So our goal is to really identify these patients at risk and protect the heart during their therapy.
Yeah, so who is at risk?
Most of the risk factors are similar to risk factors for heart disease in general. So older patients, patients that have diabetes, patients that smoke or have high blood pressure or high cholesterol. So our traditional heart risk factors, those are usually the patients that may develop complications from chemotherapy or other treatment.
Yeah, but can it happen to someone who doesn't have all of those predispositions?
It certainly can, and that's why it's important that we monitor these patients that are receiving therapy that we know might have some risk for affecting the heart.
And it's interesting because what you do is you start before treatment and move all the way through, and even after it's done, really watching that whole journey.
Exactly. We're very fortunate. We work very closely with our medical oncologists, and we help to really risk stratify the patients at the beginning, monitor them during treatment, and then even after. So in the beginning, we look for those traditional risk factors. In some patients, we might even start medications that could protect the heart during therapy. And then during treatment, we use a lot of advanced imaging modalities, echocardiogram, cardiac MRI, to really closely monitor these patients and assess for any damage early on, so we can hopefully make a difference and prevent any long-term heart effects. And then, as you said, some of these chemotherapy agents may have effects on the heart years after they've been received.
Yeah.
So it's important that we identify those patients that may need longer-term follow-up after their cancer therapy.
I asked you before we started the segment, is this something that we're just learning more about, or why is this such a big part of the treatment experience now?
Sure. I think we've known for some time that a lot of these treatments for cancer can affect the heart, but we're becoming a little bit better at protecting the heart, monitoring the heart, so it's becoming more of a cardiac specialty that we at Spectrum are very grateful that we can provide these patients.
So just as we have better technology and diagnostics and treatments for the cancer, so too for the heart, and you can match those up together and really give people such better outcomes, right?
Yes, our goal is to always allow the patient to continue their cancer therapy so they can continue to fight this disease, but at the same time protect the heart and make sure that we're monitoring the heart to prevent any secondary adverse outcomes.
So if somebody is just on the front end of a cancer journey and treatment with the hospital, you all intervene in this regard. They don't need to say, hey, I'm scared, I'm worried, I have a heart thing. You guys, that's just part of the process now.
It is, and like I said, we're very fortunate. The medical oncologists that we work with and the cardiologists in my group are very well versed at knowing which types of cancer therapies may affect the heart and trigger those patients for referral to a cardio-oncology specialist so we can keep a close eye on them.
Yeah, well, again, leading to better long-term outcomes for the patients. It's awesome to hear about.
Absolutely.
And if you'd like more information, you may contact Spectrum Health Cardiovascular Services. And if you've been diagnosed with cancer and would like a second opinion or a consultation, call 1-855-SH-CANCER. We have a link with all that information on our website, WZZM13.com. Thanks for watching. Thank you.
Thank you.